Hello everyone, hope you're doing well. Welcome to Chapter 2, Laws and Regulations that you're going to encounter, and I would say in the healthcare workplace. So there's a lot of great detail here that we're going to go over, and hopefully you've already read the text. If you haven't, make sure you read the text at least after this chapter. I'm not going to go through the chapter objectives here. You can take a look at them when you have a moment. But just an introduction to regulation, business protocols, all that kind of good stuff from the perspective of this chapter. There's a lot of regulations out there that have a really strong pull, of course, on your employment and things that you have to follow from a legal perspective in the workplace. So I know you already know that, but these are just some examples that are given in the first slide here: discrimination, sexual harassment, federal and state legislations. There's differences there, right? There's union membership, non-unions. There's collective bargaining when it comes to union membership, and also your nature of employment. That could be a contract, right? Some positions, providers have contracts, and some chief execs do too, or it could be just a employment agreement. Medical practice laws control the practice of medicine across the U.S. State legislators establish, of course, medical boards, and they control healthcare provider licensing. Washington State has a licensing board as an example. That they can renew and revoke licenses based on certain acts they deem to be outside the normal scope of work for providers. So just make sure you understand that. The State Board of Registry, as well as the state medical licensing, a law that regulates registration to the medical board. The board is made up of experts who understand and enforce the laws. They deal with provider complaints. They also investigate complaints through the records from healthcare providers' practice in the hospital or in the clinic, outpatient setting. And the board has the power to make formal conclusions according to the rules outlined by the state board. So keep that in mind as well. Here's a little knowledge question for you if you want to take a look at that. Of course, you'll have this PowerPoint so you can reference it. Okay. Mandatory reporting. There is mandatory reporting. I know a lot of people get confused on this, but births, deaths, some diseases, like COVID was an example of this, injuries due to abuse or neglect. These are all things, HIPAA is out there where we protect healthcare information, but at the same time, we have to report and have an impact on public health. So this is a public health thing. There's some people that think it's positive, some people, question it, but at the same time, this has been around for a while. And that's how we track things. That's how they're able to track how many cases of the flu we have. That's how we're able to track, that's how we're able to track COVID and all that kind of stuff from providers' mandatory reporting. Abuse, of course, is something that providers, nurses, other healthcare professionals are required to report. It's a part of the Child Abuse and Prevention and Treatment Act. Really sad that this happens, but it's something that we have to track. And something that, of course, still happens to this day, even with the many laws that we have in place. Just remember the Child Abuse Prevention and Treatment Act. It's a question that will come up in review questions. All right, another knowledge check here. You can take a look at it and the answer. There's also Controlled Substances Act. Controlled substance, of course, is a drug that can be addictive, as an example, and its chemical or storage, distribution are controlled by the government because it's a potential, it could be misused or abused. We dealt with this a lot when I was in Alaska. There was a lot of, pain medication being prescribed, which, back 20 years ago, that was kind of a standard practice in healthcare, but, now it's known that it's more addictive and can cause issues, so that Controlled Substances Act created a classification to make sure that those were tracked, and there's actually an online database you have to go through in order to make sure that you're reporting things properly. And that took a long time to change, but it's kind of standard now. It's kind of standard practice across the board. A little bit more enforcement here. There's a DEA, Drug Enforcement Agency. All providers have to have a DEA license, and they, of course, can prescribe controlled substances, but at the same time, there's a controlled substances schedule, and they're classified into 5 schedules. So you have to be really careful about what you're prescribing and the reasons behind it. They're highly regulated, in the schedule, you hear a lot about like marijuana as an example being classified as a controlled substance, but differences in federal and state laws there too, so it can get a little confusing. But from the perspective of healthcare, you're really dealing with prescription pain medication as an example. Morphine would be a controlled substance, things that are addictive, but at times are needed based on patients' needs. The USP is a collection of drug information published by the I'm not even going to try to pronounce that, but Pharmacological Society, Pharmacological Convention, and we just usually call it the USP, probably because it's confusing in regards to the term there. But they have standards for all these different things, mainly prescription drugs. And, that's why pharmacists at times work so closely with providers. There's a lot of different drugs out there. And being a pharmacist, that's a doctor within itself. And they have a great background on drug-related information, and they can actually help a provider practice better over time. We actually have them integrated in a lot of different practices across the board. The EEOC, really important, Equal Employment Opportunity Commission. It is a part of the employment law across the board. So, your workplace should be free of discrimination and harassment. But the EEOC also heightens that and says, you can't hire someone strictly off of the way they look, as an example. You have to hire them based on their merit. And of course, you can't not offer, this is really how it's portrayed, you can't not offer someone a role based on race, color, religion, sex, or national origin. It prevents that. It's something that really highlights important practice, so there's not treatment or impact in the way of discrimination across the hiring process and across the employment process. Too deep into this and confuse you, but make sure you know the EEOC has to do with the Civil Rights Act, has to do with hiring, Title VII. No employment discrimination whatsoever is allowed. I just talked about interviewing. You can't ask interview questions based on race, religion, age. You can't make decisions based on those things. That plays into it. You can have pre-employment testing, but they have to be carefully constructed and avoid discrimination. You don't really have to get into this, and I want to make sure I get through these slides, so I'm going to move a little quick here. Don't worry about the Genetic Information Non-Discrimination Act of 2008. It's interesting to read about. Definitely not a test question, and definitely not something that comes up quite often in your employment, but something if you're interested you can read about. Some information about sexual harassment. Harassment can come from a different number of people, right? Peers, subordinates, supervisors, and pretty much anyone across the board. And the prohibited behaviors, of course, verbal comments, leering, pinching, patting, all those things could be seen as sexual harassment. There's actually sexual harassment training in many workplaces, and that's something that's really, I think, come a long way over the years. And part of it is who are you hiring, and making sure you hire someone with good core values that match the organization's values. And I try to really hard to make sure I hire people that really want to be there, do the right thing for patients. And I really don't have trouble with this, but at the same time, it's something that's out there in the workplace and we have to be aware of. And there's actually a zero allowance, or we don't allow this type of behavior whatsoever across the board. Discrimination and disabilities, even more here. The ADA is something you should really be aware of. It really, it's kind of like preventing discrimination for people that have physical and mental disabilities in public employment, services, accommodations, and telecommunications across the board. A really great law that was put into play many years ago. If you want to read about that, that's a great thing to do research on. I really recommend it. The ADA and the Civil Rights Act, all those different ways they came about and the reasons why. A lot of great information there. I'm not going to get into this, but there's an Equal Pay Act and there's a Fair Labor Standards Act, and the Fair Labor Standards Act comes into play quite often. So does FMLA. Lots of detail there. And there's some more information here about the Fair Labor Standards Act. It's minimum wage, pay for overtime, kind of regulates the employment of children. We're dealing with the Fair Labor Standards Act, a couple laws that came into place statewide here in Washington State the last couple of years. Workers' comp and Social Security, more information here about those programs. They've been around for a long time. Of course, Social Security, most people know them for retirement benefits and dependent benefits. Medicare and Medicaid. You're going to hear this a lot. Medicare is federal insurance for anyone over 65, those with a permanent kidney failure, and those with Social Security disability. And the Medicaid is administered by federal and state governments. Federal funding usually administered mostly by state governments, and it provides health insurance for low-income individuals and welfare departments. So remember those differences. I know Medicare, Medicaid kind of sounds the same, but there are big differences between the two. Medicare is completely federal across the board. There's a lot of information I could get into that in relation to commercial insurance, some of the challenges there, some of the differences. Across the board, there's differences. All right, the Employment Retirement Income and Security Act. Don't stress too much about this, but read about it. The one important thing is HIPAA. Make sure you understand HIPAA. What we're supposed to know about HIPAA is making sure, of course, that we're protecting health information. But we're going to talk more about this in the coming modules. OSHA, Occupational Safety and Health Act, is something that really helps enforce standards in the workplace in regards to hazards, having a workplace free of those. So you don't have to stress about knowing everything about that, but OSHA is important. Okay, bloodborne pathogens is another thing that's going to come up quite often in healthcare. There's universal precautions about this, especially in a hospital. You hear about this quite a lot. OSHA and bloodborne pathogens, making sure that you have an exposure control plan, waste and disposal, all that protective equipment that you need, and training for employees. This is a little bit about working conditions and job descriptions. Most jobs are going to have job descriptions for a large organization, but some small organizations might struggle with this. You don't really run into this very often in big organizations, but you got to have a job description. You have to have a procedure manual. It's not federally mandated, but it really helps to make sure that you're following laws and regulations. Employee handbook, all that kind of stuff. Most large organizations have these things, and I'm trying to make sure I get through all these slides and not bore you guys. So there's another knowledge question here related to a procedure manual. Unions and healthcare workers, you hear about this a lot in hospitals as well. Unions are an organization that employer and the union are obligated to bargain in good faith with one another to kind of enhance the work environment for caregivers across the board. This has come up quite a bit over the last couple of years, and you hear a lot, and these are just cases for discussion. I'm going to go back to union information. You hear a lot about this in larger healthcare systems, kind of negotiating with unions and trying to make sure they reach a settlement. Sometimes there's strikes that happen based on, the employee union not getting what they need per se from the perspective of their needs. So, there can be some challenges there between the two groups, but usually they come together and work together toward a common goal of making sure to take care of our patients. So there's a lot of information here. I know there's a lot in the module as well. So make sure to take the time to go through. One thing I want to go back to that I kind of moved quick on here is OSHA and bloodborne pathogens. You're going to have in a large hospital system kind of a safety team that works to make sure that each department is OSHA regulated and has a plan in place for bloodborne pathogens. But there's usually going to be testing and training related to this, like I mentioned before. So make sure you take advantage of that and pay attention, because a lot of times, I mentioned this as the last part of my review here. A lot of times we really move quickly through these mandated trainings in an organization. If your organization has them, take them seriously because they're regulated, and you want to make sure that you understand the material. So there's a lot of information here. I hope you enjoyed it. and make sure to read the chapter as well. Thanks so much.